Discussing stress test procedures is Heart Center Chief Nuclear Medicine Technologist Carol Price and Supervisor of Diagnostic Testing Barbara McMahon. What are the different types of stress tests?
There are several types of stress tests we perform at the Heart Center. The most basic stress test is an exercise stress test. It's called a routine treadmill exam, and a patient comes in and is hooked up to an ECG monitor and connected to a blood pressure monitor and is walked on the treadmill to the best of their ability. And the idea here is to exercise you, exert you, and to reach a target heart rate based on your age and look for any changes in your ECG, which will be monitored by a nurse and an exercise technician. That's the most basic type of stress test. Then there's the nuclear stress test, and there are two types of nuclear stress tests. There's an exercise nuclear stress test, and there's a pharmacological nuclear stress test. If you're able to walk on a treadmill, the doctor will order an exercise stress test. It's very similar to the routine treadmill, except at the peak of your exercise, you are injected with a radioactive tracer. This tracer allows us to image your heart later under a gamma camera. So you will be injected through an IV as you walk on the treadmill, and then about 15 to 30 minutes after you cool down, you'll be placed under a gamma camera for about 15 minutes by a nuclear medicine technologist. The other type of stress test is pharmacologic, and it's for people who can't exercise on a treadmill for a variety of different reasons. And instead of walking on a treadmill, you will lie in a stretcher. A nurse will place a small IV catheter in your vein. A blood pressure monitor will be hooked up to your arm, and you'll be connected to the ECG monitor. The nurse will infuse a medicine called Lexiscan. Lexiscan dilates your blood vessels as if you were exercising, so it mimics exercise and increases the blood flow to your heart. At this time, you will also be injected with a radioactive tracer. This tracer will travel to your heart muscle according to blood flow, and we'll be able to take pictures of that later. After the Lexiscan stress test, you have about 1.5 to 2 hours of waiting before we put you under the gamma camera for 15 minutes. While you're under the gamma camera, you'll be required to lie still for about 15 minutes with your arms above your head. A nuclear medicine technologist will set you up as comfortably as we can, as we realize this is not always easy for everyone. The cameras will rotate around your chest and take pictures of that radioactive tracer. And what we come out with are images of blood flow to your heart muscle based on that injection you received during your stress test.
I understand that there are two parts of the stress test. Can you explain them?
All nuclear stress tests involve two parts. Here at the Heart Center, most of our stress tests are done over a 2-day period. On one day, you're scheduled for the stress test, which could be either an exercise stress test or a pharmacological stress test. And on another day, you'll come back for what we call the resting test. The resting test looks at your heart in its resting state while your heart rate is normal. So when you come in, you'll be taken into an injection room by a nuclear medicine technologist, and you'll be given an injection of a small amount of a radioactive tracer called Cardiolite. This tracer needs to circulate for 1.5 to 2 hours before we put you under the gamma camera again for about 15 minutes. This allows the doctor to compare the blood flow to your heart from stress to rest to determine if you could have any blockages in your coronary arteries.
What instructions do you give patients coming in for stress tests?
Yes, you will need to fast for at least 4 hours prior to coming. Absolutely no caffeine for 24 hours prior to your test. You will be asked to wear comfortable clothes and suitable shoes. You will be asked to bring food with you. We'll want you to eat after your exercise or your pharmaceutical part of the test. It aids in our picture taking after the exercise or pharmaceutical part of the test.
How long should I expect the stress test to take?
Depending on what test the doctor orders for you, you could be here anywhere between 1 and 2.5 hours.